Distinguished delegates, my co-panelists, chairs for this session, fellow delegates, and ladies and gentlemen. It is indeed my pleasure to be part of this panel discussion on public health management and leadership in strengthening health systems, looking at from the perspective of challenges and opportunities. What I would do is that next 10 minutes or so, deliberate on leadership development for health system strengthening in India. Let me begin with this very familiar WHO Health Systems Framework, which presents us the 6 building blocks of health systems framework: health service delivery, health workforce, health information systems, medical products, vaccines and technologies, health financing, and sixth one, leadership and governance. The intent of presenting this framework is to tell you that leadership remains a critical block of this health systems framework. But not only that leadership is an independent building block of health systems framework, but it also runs across other building blocks. Without leadership, we would not be able to provide the good, dignified, quality services to the population. Without leadership, we will not be able to advance the agenda of health workforce or routine health information systems. Without leadership, we will not be able to advance the issues related to the health financing, medical products, vaccines, and technologies. And therefore, not only that we have to see that leadership is an independent building block of the health systems framework, but it is critical for even advancing and the agenda related to other building blocks. On the right side, you can see the people at the center of the health systems building block. We're re-emphasizing the relevance and importance of leadership development in the context of the health systems building block. But what kind of health systems do we need? I would say that we need a smart health system to deal with the challenges of the 21st century. And when I say a smart health system, what does it mean? It means a strong and sturdy, sustainable, vibrant, robust and resilient, agile, efficient, resource optimizing, effective, equity promoting, inclusive, empathetic and people-centric, responsive, technology-driven, and culturally sensitive health system. This is what we require for the 21st century public health challenges. Having said this, we could see that recent pandemic, COVID-19, has taught us several lessons. And therefore, I would like to say that history is more than the path left by the past. It influences the present and can shape the future. Therefore, it is critical that we leverage the learnings from COVID-19 pandemic for strengthening health systems in India. We need to recreate health systems that can anticipate, avert, attenuate, and alleviate any health threat while dependably delivering all other needed health services with efficiency, equity, and economic prudence. And continuity, commitment, and compassion, where quality and dignity remains the hallmark. This deliberation emphasizes on the leadership development, therefore remains critical for the stronger health systems. Now let's move on to when we say that leadership development is critical for health system strengthening. Try to answer a few questions. Are leaders born or made? Some may be born, but most are made. Can people learn how to be a leader? Yes, with great certainty. People can learn to be a leader. What Waris Benis tells us that the most dangerous leadership myth is that leaders are born. That's nonsense. In fact, the opposite is true. Leaders are made rather than born. And therefore, again, re-emphasizes we need to invest strategically, consciously, and systematically in building leadership skills and competencies. And therefore, leadership development remains critical for stronger health systems. Now, how do we do that? There could be a multi-pronged approach for building leadership competencies. One of the important issues that I would like to highlight regarding redesigning our health professional education with emphasis on transformative learning. Why I'm saying so? If you look at the levels of the learning, there are three levels of the learning: informative, formative, and transformative. When we talk about informative learning, we deliberates on transfer of knowledge, information, and skills. And into, therefore, informative learning produces experts. But when we move a step further forward and talk about formative learning, it, in addition to the information and skills transfer, talks about socializing values, ethics, and models, and thereby ensuring us to produce professionals. But a further step forward is a transformative learning, where it talks about the critical objectives of informative and formative learning, but additionally emphasizes on leadership attributes, creating those leadership competencies, which would produce enlightened change agents for the health system. And therefore, one of the most important and critical driver for health professional education reforms for the 21st century would be a transformative learning. But when you talk about transformative learning, we need to also look at what are the reforms that would be necessary. We would require reforms both in terms of instructional reforms and institutional reforms. Instructional reforms will help us to advance the agenda of transformative learning, and institutional reforms will help us to advance the agenda of interdependence education. And transformative and interdependent professional education will help us to have the leadership development as an integral part of our health professional education. Are there opportunities for then leadership development? Yes, we can undertake several leadership development initiatives and look for the opportunities. The first and foremost could be, because we work in medical schools and engaged in health professional education, both at undergraduate and postgraduate education for medical students, nursing students, pharmacy students, public health graduates, and everyone. We need to see that how do we incorporate leadership as a part of the curriculum and competencies for the undergraduate and postgraduate curriculum. Then moving further forward into academic public health programs like MD in community medicine, or health and hospital administration and management programs, or masters in public health, applied epidemiology, and other related programs. Executive trainings and in-service trainings also provides us an opportunity to build on leadership competencies and skills. Specific capacity building initiatives, when NRHM was launched in 2006, now we call that NHM, also has a postgraduate diploma in public health management, where 11 institutions are offering this program, which is supported by the government of India, emphasizes on management and leadership skills. We can design a tailor-made mentorship programs to create the second generation leaders for advancing the health systems framework network and contribute to enhancing and responding to the challenges of the public health. Leadership competencies we need to understand not only from the cross-cutting perspective, from the core competencies point of view, because they remains the core as a hallmark of the health systems building framework that we looked at. And leadership development is beyond the capacity building. Capacity building could be an instrument for that, but subsequently we need to see that how do we bring it into a practice and policy in the context of public health. IAPSM has taken up several initiatives in the context of leadership development, and I have a privilege and a pride to mention some of them, like IAPSM Young Leadership Program that we launched last year. The first IAPSM Leadership Conclave was conducted in Wardha and in Savangi. The next one is planned in the next week on 5th, 25th, 26th, 27th in MGIMS Sevagram, where our young leadership is being given an opportunity to showcase their talent, learn from the senior colleagues, and also demonstrate their leadership competencies and skills. And it has mentorship program and several other initiatives. Academic IAPSM Connect is one of the another initiative that IAPSM has launched, providing the platform to our younger leaders to demonstrate and deliberate and discourse on relevant public health issues. IAPSM textbook Community Medicine, the second edition, is now released, and you would appreciate that the several authors who have contributed to the IAPSM textbook of Community Medicine are from the younger generation. This IAPSM National Conference being held at Chandigarh also has provided space for young leaders. Our young involvement of young members in IAPSM initiatives is quite very well reflected, and we have systematically and consciously decided to bring our leadership to the forefront. But when you talk about leadership development, it has multiple dimensions. It could be in the thematic area that we need public health champions in the area, for example, vector-borne disease control, or tuberculosis, or maybe non-communicable diseases for that matter. Or it could be like, for example, tobacco control. Similarly, in health systems framework, advancing the agenda of health workforce or health information systems, or for that matter, service delivery related issues. Of course, we need leadership in health research to create evidence and translate that evidence for the policies and programs. Health professional education is another important critical dimension area where we would like to engage and produce leaders. And of course, we need to create public health leaders for leadership positions. And therefore, we talk about advocates and champions for public health being created when we look at all these dimensions. Management is doing things right and leadership is doing the right thing. This is what the Peter Drucker tells us all about. Management and leadership goes in hand, and therefore when you talk about leadership, we will continue to re-emphasize how do we build management skills also. And efficient management without effective leadership is, as one individual phrased it out, like strengthening the deck chairs on the Titanic, needs to be realized and recognized. Finally, I wanted to conclude by saying empowering women leaders in public health remains critical for advancing public health agenda. This year, 8th of March, couple of weeks back, United Nations International Women's Day theme is Women in Leadership Achieving an Equal Future in a COVID-19 World. Applauds the effective national leadership of women across several countries in variety of the roles in combating this pandemic. The emergence of the female leaders in the public health system can become a centrifugal force for the good in the world that needs to be realized. And therefore, to conclude, leadership development for strengthening health systems in India remains critical for revisiting the health systems architecture, reanalyzing health challenges, re-articulating public health priorities, and redesigning new health systems for 21st century that will help us to advance the agenda of health assurance and sustainable development for the betterment of the tomorrow in the 21st century, and will help us to create Swasth Bharat along with Swachh Bharat and Sashakta Bharat. Thank you so much for this opportunity.